Hello everyone. Today we will discuss about the PLAB2 preparation, which is an OSCE based exam in which you are assessed with the different clinical scenarios, and there are almost 18 stations you are assessed, and two of them are rest station, and 16 stations are there in which you are assessed clinically how you manage the patients of different categories. In these 16 stations, there is an examiner sitting in front of you, and there is a patient, a stimulator which play a role of patient, and you are dealing with the patient, and examiner is assessing you during that case. So if you talk about how many types of stations are there, actually there are different types of stations cases which are assessed during these 16 stations, and one most common type is a daily day-to-day case scenario. Like it can be from a medicine scenario, it can be surgery, psychiatry, gynae obs, it can from the pediatrics, dermatology, and it can be from any department. Like it can be from the GP clinic, it can be emergency department scenario, it can be indoor department, it can be from the counseling station, you have to counsel the patient, and it can also be from the ethical point of view scenario. So in these all cases you are assessed with three categories. Like you are assessed with the data gathering, how you gather the data from the patient, how you take the history, how to diagnose the patient. Secondly, you are assessed with the management of the patient, how you manage the patient. And third and last thing you are assessed is the IPS, interpersonal skills, communication skills, how you manage the patient and how you talk to the patient during all these diagnoses, data gathering and management. All these three parts are given 4 marks, and total there is 12 marks station for each station, and 8 minutes are given for each station, and there are total 12 marks. So you are assessed during these stations, different scenarios. This was one type of the scenario which I assessed during this exam. Second type scenario is the teaching scenario, in which you teach a medical student or your junior doctor or your colleague or nurse, and the examiner is assessing you. First was the case scenario, second is the teaching scenario, third can be from the prescription writing. You have to write a prescription of a patient. A patient is admitted in the hospital and consultant had given a medicine that you should give your patient and write down on the prescription chart as we write in our hospital. So you have to write the prescription either from the BNF, and that is a book in the UK that is followed for the drug prescription. You have to see that BNF book and write down the prescription. So, and the other thing which is other type of station which is assessed is the examination scenario, in which you perform a complete examination of a patient. It can also be a combined scenario in which you take the history, then perform the examination, and then perform the management of the patient, or it can only be the examination scenario. Other type of scenario is the procedure case scenario, in which you perform a procedure. It can be IV cannulation, it can be blood sampling, or urinary catheterization, or passing the NG tube. So there are different procedures which can be assessed during these case scenarios. So for the purpose of examination you perform during this exam is there are many mannequins or semen plates. So mannequins are like dummy structure that are placed there to perform the examination, and there are also some semen station. In semen station there it is basically emergency case scenario, and it is an advanced patient like dummy, but you can assess the pulses, you can feel the heart sound, you can hear the heart sound, the bowel sounds, and the respiratory sounds. So you can also feel that things in the semen station from the dummy. So this is basically advanced patient. So if we talk about the resources from where we should prepare the PLAB2 exam, first of all we should join the academy, because academies are there to direct us how we should prepare the exam. They give a complete structure of the exam, they completely guide about the preparation and type of scenarios, and about the management and some history and some procedures and the standard guidelines according to the PLAB2 exam. But you should not strictly follow the academy rule. For the history you should make your own notes. First of all you should read the notes of the different academies. Mostly you can read the notes of one or two academies, but not more than that, because you will be confused after reading more than that notes. It is preferable to read your own academy notes and then make your own notes. I used to do this thing during my preparation, and it has saved a lot of time. Initially, it was a very time consuming thing to make your own notes of the history, management, and everything like that. But at the end, that was very easy for me to revise each and everything after making my own notes. So, from the history point of view, you can read the notes of the different academies and make your own notes. But if we talk about the management, you should only follow the NHS website. That is the very standard guidelines given in the NHS website according to the UK, and it is very in easy language. You can understand easily, and you can also talk to a patient very in easy language. And they also want you to speak like that in a junior doctor language, in very simple language that the patient can understand easily. So, from the history, you should prepare your notes, follow the notes of the different academies, and from the management point of view, you should follow the NHS website. And third point is the different examination we see, different procedures we see, different prescription writing we see. You can also follow your academy and also follow some videos on the YouTube, mainly the geeky videos that are also very good for the preparation of different examination, that are also standard examination video you can follow and perform during the exam. The other thing is the IPS. That is very important during this exam, because mostly, like if I talk about myself, in Pakistan we don't have any IPS while dealing with the patient, in a communication skill while dealing with the patient. So it would be very difficult for us to manage that thing during the exam. So if you see the Dr. Aman Arora videos on the YouTube, that is a very excellent videos regarding the IPS. If you follow that, and there is also audio present on the YouTube, and the Dr. Aman Arora website, you can also buy that audio. That is almost 2 hour audio, and that 2 hour audio cover almost each and every station of the PLAB2. And there are different lines given by the Dr. Aman Arora that will help you prepare for the PLAB2 exam, and in communication skills and IPS tremendously. So you should follow the Dr. Aman Arora communication skills tricks to pass your exam easily. If we talk about the duration, how much duration we require, usually the person who is totally free, is not performing any duty, he should at least spend 3 months for the preparation of PLAB2 exam. And the person who is performing daily duty, 6 to 8 hour duty, he should at least spend 4 months for the preparation of PLAB2 exam. And for this preparation, you should join academy, and before that academy you should read the notes of academy. So you should have an idea in your mind what kind of scenarios are asked during the PLAB2 exam. And during the academy, during the video, during the lectures of the academy, you can also ask the questions about the scenarios, the understanding of the scenario, which is difficulty for you. So there are three most important things for the PLAB2 preparation, that are partner, persistent, and practice. The perfect practice with the partner and persistently, that will improve your preparation for the PLAB2 exam. So you should choose your partner wisely. That should be motivational and positive feedback to you for your mistakes. So you can choose 2 to 3 partners. I also have 2 to 3 partners during my preparation that help me a lot for my preparation. And when you land in the UK for the PLAB2 exam, you should talk more and more to the local people to gain some more confidence while talking to the local people, so you can perform good in the PLAB2 exam. And during the exam, when you are conducting a scenario, if your time is over, because there are only 8 minutes for the whole scenario, and it is very difficult for you to complete the scenario in the 8 minutes, you should practice with the timer. You can also download the PLAB2 timer from the Play Store, and you can practice accordingly. But you should set 6.5 minutes or 7 minutes during the practice, so that you can do the scenario easily during the exam. But during the exam, if you have not completed your case scenario in the 8 minutes, and you are only stuck in the history and management, please don't rush to complete the scenario. Just leave the scenario then and there, and say thanks to the stimulator, the patient, and also to the examiner, and leave the room. It will also leave a good impact on the examiner for you. Like in my first case scenario, when I was giving the exam of the PLAB2, I was only able to reach the start the management when my time was over. But I completed my scenario then and there, and said thanks to the patient and the examiner. And fortunately, I have passed in that scenario. And other thing, you should be confident during the scenario practice and during the exam, but not be overconfident. and I had an example of that also. I was doing the mocks during my PLAB2 preparation in my own academy. I joined the Aspire Academy. You can join any academy. Every academy is almost similar, with a little bit different. So I do not recommend any academy. You can join Samson Academy, the Dr. Mo Academy, or Aspire, and different hundreds of academies are there for the PLAB2 preparation. So you can join any academy. So during my PLAB2 mocks in the Aspire Academy, I passed a station mock exam with very good marks. Then I also gave a mock in the Dr. Mo Academy, that I also passed that station very good marks. So I was then the exam the case was same in the Dr. Mo Academy, in the Aspire Academy. The same case which I passed with the very good marks in the Dr. Mo and the Aspire Academy, the same case came in my PLAB2 real exam. So when I was giving that exam, by performing that case, I was very confident. I have already passed that exam 2 times in the mock, and it was very easy for me to pass. But when the result came out, I was actually failed in that exam. That was just because of the overconfident, because the case was already in my mind. I spoke to the patient according to that scenario which was already in my mind. I didn't think any naturally. I didn't talk naturally. So that was almost everything was scripted, looking like I was scripted. So that caused me to fail that exam. So always be natural in your tone, because when we were going to start the exam on the PLAB2 exam, there was a counselor who was telling us about the PLAB2, how will you take your exam, everything about that. And he was telling us on the exam PLAB2 exam day, that there is no way of the PLAB2 exam. It is your way you are bringing from your country to give the patient. So please talk in your own natural tone, natural way, but according to standard guidelines. So don't look scripted. Always be natural. Try to look natural. Be scripted somewhat, but not completely. So you also follow the guidelines, and also don't be completely scripted. And during the practice, you should at least practice 6 to 8 to 10 stations with your partner, and you should at least spend 6 to 10 hours for the practice. So it will improve your practice very smoothly. You can also download a monitor for Simon from the Play Store, and also the PLAB2 timer from the Play Store for your practice. And if you talk how much time we should spend in the UK when we go for the PLAB2 exam, in my opinion, you should spend 1 to 2 weeks maximum. The 1 week you should spend preparing for your examination, the mannequins perform, and the Simon examinations in your academy, and the 1 week you should spend on yourself at the end of just before the exam date. So that will help to prepare very effectively.